Insights learned. During our stay in CMGH for 6 days, we have learned many things, and these are the following. We learned how to get along with our patients, with our co-nursing students, with the staff nurses, with our clinical instructor, and with the patient's relatives. We also learned that therapeutic communication is essential in dealing with your patients to establish rapport and to gain their trust in you. The nursing skills and knowledge we have are being applied during our duty in CMGH. The very good thing in the hospital is that our hands-on experience, that is the actual setting of how we really act and respond in front of our patients, staff nurses, and doctors. Time management is also needed. Every nurse must know how to manage his time well, especially when there are many works to be done for him to be productive. As trainees, we, the nursing students, must practice accurateness and precision in everything we do, especially in doing physical assessment of the patients and recording of data gathered. This duty really boosts our self-confidence. We have to have trust in ourselves in order to do our work being a nurse student. Every nursing student must have presence of mind, must be alert and on guard. Because the fact that we handle the lives of our patients, we must be very careful enough in what we are doing. All of our lessons and insights learned are summed up in 2 words, and that is being responsible. The factors that facilitates our learning in our duty in CMGH are as follows. Enthusiasm of the learner. First and foremost, we, the nursing students, will not learn anything unless we have the interest and eagerness to learn. As the saying goes, if there's a will, there's a way. Meaning, if you have the will to learn, you will learn. No matter how much they encourage you, if you don't desire to learn, you will never learn them. No one can dictate you or can insist you to do a thing unless you permit it. Efficient clinical instructor. Our clinical instructor, Mrs. Christine Marie Valisno, explains well all the activities to be done throughout the rotation. This includes the lectures on how to determine the regulation of intravenous fluid per minute, teaches how to do charting, endorsing, and supports us in our case studies. She makes sure that we all understand the topics we tackle and procedures we do. During our duty, she goes around in the area to check us one by one on how we deal with our patients and how we do the vital signs taking and regulating the IVF. She also reminds us when to submit our written requirements. Approachable staff nurses. The nursing students are encouraged to do their best in their duty if the staff nurses are approachable and understanding. In endorsing, we communicate with the staff nurses, and that enhances our communication skills, which facilitates learning. Good learning experience in the hospital. The ambience of the CMGH is appropriate as a training ground for the nursing students. With clean, quiet, and well-ventilated area, nursing students can do their work easily and conveniently. Availability of hospital facilities and services. Being a private hospital, CMGH is good in terms of the facilities and services. New technologies are available and being maintained for the benefit of the patients, doctors, nurses, and student nurses. Hindrances in learning. Nursing students might learn less if he has low self-confidence. He cannot perform with the best of his abilities if he doesn't have trust in oneself. Being uncooperative of some patients is one of the most hindrances we encountered. We cannot get accurate results or baseline data from them if they lack trust on us. The fear of the students to commit mistakes and fear of being scolded by the staff nurses is also one of the reasons or hindrances in learning. Tendency: the nursing students will not take initiative to do tasks in the area because of his fear of committing mistakes. The fear of the students to reject him by his patient. We couldn't deny that some patients are unkind, and this is maybe because of the pain they are suffering from. Sometimes, they tend to do things or say things that will hurt the nursing students' feelings. If this will happen, tendency is that the student will be having lower self-esteem and confidence. Recommendations. First, immunization of the nursing students. They must be well protected from communicable diseases of patients like measles and chickenpox. Second, more time for the interaction of the nursing students with their patients. Third, more activities to be done regarding the application of skills learned in the school.